guys, welcome back to my channel. I'm back with a new video. So it's a little different. I'm going to just be talking to you guys about some of the benefits or like pros to working at a plastic surgery office. I don't know if this will help anybody or if you're looking to get into the industry or like see what it's all about, then maybe you'll like this video or enjoy it. I wrote down some notes in my phone, just a few things that I would like to point out because this is some stuff that I didn't know that you could get while working at a plastic surgery office. So maybe somebody else out there would like to know. So I'm just going to give you a little background on my experience. I have worked at 2 offices for a total of 4 years. The first plastic surgeon I worked for was more of like a private one doctor, one surgeon practice. There was one surgeon, one nurse, one patient coordinator, one front desk, which was me, and one office manager. Pretty small, tight-knit office. We did have an operating room inside of the suite. Both of the offices I worked at did, but this one was literally inside the suite. Like the front of the office would be here and like the door over here would be the operating room. So usually when there's an operating room inside of the suite, those are mainly for cosmetic surgeries. And the medical type surgeries like breast reductions, breast reconstruction, those are done in the hospital. Whatever surrounding hospital your doctor is in network with or what do you call it, have privileges at. So yeah, the first office I worked at, it was kind of a shit show. The doctor was a complete asshole. I'm not going to name any names because he's pretty popular around the area, but he was a complete asshole. The office manager, to me, I think she was racist. The one who hired me, she didn't end up being the one that was there when I left. She hired me. She was kind of mousy, kind of inexperienced. She didn't really know what she was doing, but she was such a sweet lady. She actually used to work as a manager at Saks, and she ended up being, there was a Saks Fifth Avenue across the street from where I worked, and she got the job after I think a friend of hers recommended her because Saks let go of her position, so she didn't work there anymore. Whatever. She was a really nice lady. I just think she was really inexperienced. She would like cry all day on the job because she didn't know what she was doing. She was a little much, but she's the one that hired me. But then they hired some lady from down south. If you're from the DMV area, you know that DC, Maryland, Virginia is kind of connected. So this lady was from the Virginia part, a little further down Virginia in the south. And I just think she was racist. I don't know. She treated me way different than she treated everybody else in the office. So yeah, that's why I ended up leaving before I ended up having to smack up. But anyway, that was my experience at that first office. So I will say, do your research on the doctor before you even go on an interview. Do your research on the office. This is something I wish I would have done before I came to this office because it was a little ratchet, but he was a great surgeon. He did great surgeries. Like his results were like amazing, and I was so surprised because the office was not the typical plastic surgery, like really glitz and glam, but he was a really good surgeon and most of the staff was really nice. So the office I work for now is a practice of 4 surgeons. We have office managers, a little more organized. We have 4 coordinators. Each of the surgeons have their own patient coordinator. There's 2 front desks. We have 2 locations, so there's 2 front desks at both offices. 4 patient coordinators, office manager. We have a ton of nurses, I think about 6. The operating room is inside of the suite, but we do have 2 suites on the floor, if that makes sense. And there's a whole nother staff of people over there. So this office was a little bit more organized, a little more structured, more policies. There are some downsides to it, but I'm not going to go into that in this video. So yeah, that's just a little background in my experience. I was at each office for 2 years each, so I did learn a lot, and there were a lot of benefits, a lot of perks into working into these offices. So I'm just gonna read from my list and let you guys know if you're interested. So the first thing, and probably the most important, you could probably get free surgery or discounted surgery. So the first office I worked at, he didn't offer free surgery for employees. He did offer a discounted rate, so you would only pay for the implants and the, well, if you got breast implants, you would only pay for the implants and the anesthesia. If you get like a tummy tuck or lipo, you would only just pay for the anesthesia, which anesthesia could run you some money. It's still thousands of dollars, so don't think it's like that much of a discount. So you might be coming out of your pocket at least $2,000 to $3,000. Still $5,000 at the most if you get like the whole body done. So that's still a good deal because as a patient you pay up to $10,000, $15,000 for surgery sometimes. So I think that was a good thing. He did give a discounted rate on fillers, 50% off. Botox he would do for free sometimes if you just ask him. Products were 50% off. We got a really good discount on products. So most plastic surgeons might sometimes have a med spa connected with. Both of the offices I worked at did. There was a med spa, so we offered skincare services, skincare products, so you do get a discount on those. But most of the times you can just ask the esthetician on staff if you want a treatment or get something done, they'll just do it for free. I'm not going to say every office is like that, but both of the ones that I worked at were like that. So yeah, free surgery. I did get free surgery at the office I work at now because they didn't have like discounted surgery. You got the whole thing for free. Like anesthesia was free, the implants were free, the doctor's fees were free. Like the only thing I had to pay for was my prescriptions, my medication when for my recovery and anything I needed for recovery, like my compression bras. I got 2 of those. They were $24 each. So yeah, not bad. That's a really good perk. And then the job I'm at now, they had filler and Botox day. So Botox day would be every 3 months. You get free Botox up to 40 units because the span of Botox is usually 3 to 4 months. So I did utilize that perk. We did get a filler day once a year, which I also utilized. So it's free. Why not? So yeah, I would say the perks at the office I'm at now was way better than the one that I previously worked at. So yeah, if you're looking to get maybe free surgery or a little Botox and filler, then you might want to research some plastic surgeons in the area, see if they're hiring or what their benefits are if you get to the interview part, because that's important to know. Like if you're going to be working for the company and you want to take, care of yourself and know what the benefits are, then get in where you fit in, girl. So yeah, the next one I have on here is like the med spa, free skincare treatments or discounted products. So like I said, I did have a med spa attached to both of the offices I worked at. So the first one I worked at, there was one esthetician on staff. She did hydrofacials, regular facials, chemical peels. So I would get like a hydrofacial every single Friday or every other Friday if she had time. So that was a really good perk. My skin really benefited from that. She would do like pore extractions and clean out my pores. I did get products for a really good price. And med spa products, medical grade products are so much better. I don't even buy skincare from Ulta or Sephora anymore. I only use medical grade products. There are a few products from the drugstore or like Sephora that I still use for my skin, but everything I use is from the places that I worked at. Like brands like Eyes Clinical, Aven, Image, what is there, Elastin, Zoe, Abaji. Like these are really good brands. I'll link some of them down below. Most of these you cannot buy online, and if you can buy online, they're most likely a fake. You have to go inside of the med spa or call and have them ship the products to you if you want to do that, but it's totally worth it. They're a little bit pricey. The discount really helps because I don't think I would buy any of these things if I had to pay full price for them. So yeah, that's another perk. The office I'm at now, I've gotten chemical peels, I've gotten microdermabrasions, I've gotten facials, I got my brows, because we do permanent makeup. I got my brows touched up. I did get my eyebrows tattooed like years and years ago, but they started to fade, so I did get them touched up at my job I have now for free. Lash tint, eyebrow tint, you name it. Like, so that's another really heavy perk of working at a plastic surgery / med spa office. So the next thing I have is learning a lot. So I did learn a lot. You learn the official medical terms for these surgeries, like boob job or get your boobs done, like it's called a breast augmentation, things like that. Like a tummy tuck, it's usually called an abdominoplasty, like lipo. I didn't know that getting your arms, like the fat removed from your arms, is called a brachioplasty. You get your eyes done, that's a blepharoplasty. Like there's little things that I know now that I didn't know before. You sound a little smarter if you know the official medical terms for these. And I will say, if you've never worked in a plastic surgery office, and this, if you're getting a new job in one, I would research medical terms. I would research the procedures and what actually goes into the procedure, because a lot of patients call and they ask and they want to know some details, and you want to know the answers to those questions. Another thing I didn't know before I started working in a plastic surgery office was plastic surgeons do reconstruction for breast cancer patients. I did not know that, but both the offices I worked at, the surgeon did do recon surgeries. So the patient, when they have breast cancer, they have a breast surgeon and a plastic surgeon. The breast surgeon does the mastectomy part, which is the removal of the breast, and the plastic surgery does the reconstruction, which is getting the implants, putting those back in. And those are usually covered with insurance because it's a part of the whole breast cancer process. So the next thing I have on the list is a little bit vain, but a lot of people can't do this at their jobs, but the way you dress, or like the dress code at work, is a little different. You can dress a little more sexier, a little more like nicer. You can wear, like the first office I worked at, he did not care what we wore. I could wear literally anything I want. I came to work in like cute skirts, cute tops, whatever. There was a one day in the office he wasn't there, which was Wednesdays, and I can come in wearing sweatpants or pajamas if I wanted and just do my work, you know, independently. So that was really nice. The office I worked at now is a little more conservative, but you can still wear cute outfits. So I think that's a perk, because most office jobs are like strict dress codes, like collar shirts, slacks, whatever. So if that's something you're looking for in a job, then maybe look into working for a plastic surgeon, sorry. The next thing I have is networking. So networking is really high in most of these offices because you get a lot of reps that stop by to sell up and coming items and new things. You have product reps coming by, Botox and filler reps. So I got to know most of the reps on a personal basis that came into the office. They're really nice sometimes, and you can sometimes get samples out of them. Like we have skincare reps that come in and give full-size samples to some of the staff, and you get to try things out before they launch and all that. So there's also events. I know IS Clinical does a seminar every single year, like around May or so. I don't think they're going to have one this year because of coronavirus, but I've gone to the past 3 or 4 that they had, and they always give out full-size products. You learn a lot about the products. You learn like the ingredients in them, what makes them work, like the doctors on staff that actually, you know, make the products, or like make the technology that go into the products. There's a lot of things you can learn. So I would say networking is a big thing. Yeah, so the next one, I have 2 more things I want to touch on. So if you're still watching, then you might be interested. So there's a couple more things you want to know about working at a plastic surgery office. Sorry, I don't know who the hell was banging something, but the office I work in now is in Virginia, Northern Virginia. And again, if you're from the area, you know that Northern Virginia is a very high-end money area. So based on the area, the surgeons get more clients, more high-paying clients. So yeah, so that affects your salary as well. And the last thing is, most offices, even when you stop working there, you get a discount for like the lifelong discount, I guess. So both offices I work for, you do get like a 10% discount if you come back as a patient or a client. I know me, since I had surgery, I'm going to have a replacement surgery in about 10 years. So I will go back to either surgeon that I work for and get the replacement, and I can get a 10% discount on surgeon fees. yeah, so the office I work at now, I can get a 10% discount on surgeon fees if I come back as a patient, which I definitely will, because who else is going to do my surgery that knows me? You know, I want to go to a surgeon or surgeons that I know. The surgeon that did my surgery, he's actually probably going to be most likely retired by the time I need a replacement, which is so sad because I think he's the best in the business, but that's just my opinion. So yeah, I hope you guys enjoyed this video. If you're looking to work in the industry or looking to get some of these perks that I just mentioned, then I'll list the whole list that I just went through down below so you guys can have like a written reference. And I hope you guys enjoyed this video, and I'll see you in my next one.